Good morning. Today we are so delighted in Hadi Clinic to announce the affiliation between the Harvard Medical School and its largest affiliated hospital, the Mass General. This is one of its kind, not just in Kuwait, but this is the first affiliation in the Middle East. This is what's going to reshape healthcare for the future in the area. We are delighted here as well to have Dr. Shimali to be with us presenting the Harvard Medical School.
Good morning. Thank you for having me here. So I'm Gandhi from Kuwaiti newspaper. Why Harvard chose Hadi Clinic for cooperation among other hospitals in Kuwait?
We are delighted for that collaboration to happen. We know that Hadi Clinic is a pioneer in the area of telemedicine and is one of the top hospitals in Kuwait, and coming from an excellent hospital also in America. We would like this collaboration to be among two very good hospitals to get to the patient's needs and to assess whatever they need for them and their families at the highest level of medical care that is integrated and holistic and just the best of the very best.
Okay, thank you. Other question for Dr. Fatim. What are the aspects of cooperation between MGH and Hadi Hospital? Will it be in all fields or only in the fields of study and developing methods of treatment to fit with Kuwait?
Actually, the affiliation is going to take two phases. The first phase is going to start with behavioral health, and then in September we are going to launch the full affiliation with the Mass General. And it's going to include many specialties. It's going to include door-to-door, where the patient, we can facilitate his trip and consultation in Mass General itself. And also, it's going to also include learning and educational session that we are going to have it in-house. And we are going to bring the Center of Excellence from Mass General. As you all know, Harvard and Mass General, they have best practices in the world, and we are going to bring them here to learn from them. Not only that, but in September you are going to hear much more than that.
Did you mean in future there is studying and result for this area in Kuwait or Gulf?
Yes, it is also going to include, like Dr. Shimali, what she mentioned, telemedicine. There will be also telecommunication, teleconsultation. The patient is going to be, it's going to come to Hadi Clinic, and he is going to consult with physician from the Mass General while he is in Hadi. And this will facilitate treatment for him. And also it will include a few researches that the Mass General is going to conduct here in Hadi. Yeah.
I'm going to take the first question that came through, which was if the treatment is focusing only on remote communication, providing guidance, or would there be something else developed through Hadi Clinic on medical services? The answer to this question is definitely there will be a regular weekly telemedicine consultation between Hadi and experts, world-renowned experts from MGH on many areas, starting with behavioral medicine. But that is not going to stop there. There will be other programs where there will also be studies, research, fieldwork, consultancy happening in behavioral medicine and in other areas as well. And the whole purpose for all of that is to bring the best of MGH to the Kuwaiti people, but in a Kuwaiti environment. So that will be very population driven from Kuwait to Kuwait, with the expertise and the learning both ways between Kuwait and Hadi Hospital in Kuwait and MGH in Boston, the USA. Following up with also the question between the hotline between patients and doctors and the clinic, and there was a question asking if the patient will immediately have access to doctors at MGH. The answer to that is that the patient will have access to doctors at MGH through Al Hadi Clinic. The collaboration is with MGH and Al Hadi Clinic through their telemedicine. So patients will have to come to Al Hadi and through telemedicine, let's say on a weekly basis, to have that connection done through Al Hadi and not directly from the patient itself to MGH in that collaboration.
I guess this is the last question for me, and it states, will the collaboration evolve making Hadi Clinic a center for the Gulf region and a link between a Gulf Medical Center and MGH? I guess yes, and like I stated before, hopefully it's going to reshape the healthcare in the Middle East, and this is the dream of the Hadi Clinic. Thank you.
Thank you.